Hi, everyone. I have the tough job of sitting between you and lunch, so I recognize that. Thank you for your time and attention. I'll get you to your sandwiches very soon. Again, my name is Lisa Eisenberg. I'm the policy director with an organization called the California School-Based Health Alliance. I'm really excited to be here this afternoon, or late morning, I guess, not quite afternoon yet, to talk about money. So moving from data to dollars. If you're not familiar with our organization is a statewide nonprofit that advocates for school-based health services. We see this as a way of addressing health-related barriers to learning, as well as increasing access to healthcare services by putting them in school settings. And we really center our work around the model of school-based health centers, so comprehensive health clinics on K through 12 school campuses. We have a website. I'll be talking about some of our funding resources that are on our website, but we have lots of free resources on our website about starting school-based health centers, sustaining school-based health centers, as well as information around a lot of topics related to school-based health. So I've been invited this morning to talk about funding, and I'm presenting on information that we've put together in a resource that's available. It's called Public Funding for School-Based Mental Health Programs. So I'm really focused on the school-based mental health part of many of the systems that you all are talking about today. There's a link on your slide to access the resource. We released the resource first in about 2017 and then updated the guide at the end of last year and redesigned it. So it's a new look of very much some of the same information that we released in 2017, but there's so much one-time funding going into school-based health and particularly school-based mental health that we thought it was really pertinent to provide new information about, after this one-time funding goes away, how do you sustain those programs and services that you started and invested in? We also find that when you have local education, you have your education partners and your healthcare partners coming together, and often you're very familiar with the funding resources that you have in your system, and a little bit less familiar about what might be available to your partners or what your partners can bring to the table. And so this guide is really meant to help share information so that we all have a shared understanding of the multiple different funding streams that can be leveraged to support a full continuum of school-based mental health services. So before I share a little bit about the model we're putting forward about how to best leverage funding, I think it's really critical that I walk through our guiding principles for sustainable funding. I'm going to be suggesting some ways to use dollars over other ways to use these dollars, and so I want to make it really clear what are the principles informing those suggestions. So the first one is that there are 8 funding streams that we talk about in the guide. They can be used, some of them can be used in many different ways. Some of them can be used in more specific ways. However, we believe that there are really strategic ways to use the funding to support a comprehensive system. The second one is that depending on where you're coming from, you might be coming to school mental health from an educational lens or a healthcare lens. And so we really believe at the California School-Based Health Alliance that school-based mental health services serve both. So they meet the educational needs of students by reducing barriers to learning, and they address healthcare access. So by putting these healthcare services in school settings, you are increasing access to these services for young people. So you might be on one side of that perspective, or you might be aligned with what I'm saying is that it serves both. But we really think, especially when you're working with partners, that's really important to understand that your partner might be coming to this school-based mental health arrangement from their lens, that they want to increase access to healthcare services and or address educational barriers to learning. The third one is that We really believe that investments in administration and coordination are key. I think oftentimes, understandably, we are talking about how do I get direct services to students right away, especially now there's a huge need. And as we're looking at one-time funding and as we're looking at sort of pulling different funding streams together, I really believe that how you are setting up an infrastructure on a school campus to connect students to the right services, funded by the right funding streams, is really, really critical. And then the last principle, which I hope we all agree on, but you know, sometimes it's helpful to say, is I really think it's important to sustain services across the 3 tiers of school mental health, from prevention to targeted services to more intensive services. So I think sometimes when we look at one-time funding, we look at grant funding, we're looking at services on one part of that pyramid. And the whole goal of our toolkit is to really show what funding streams can be used across the pyramid. So this is the funding model that we have in our toolkit. I hope you can, sorry, I realize that some of the font is small on your slide, but at the core of this illustration is the tiered system for school mental health, the pyramid of school mental health with the 3 tiers, from school-wide interventions, targeted, and long-term intensive. And it's intentional that we're putting the pyramid at the middle. So I think really what we are trying to convey with this model is that really at the core of your plan for funding should be the services that you want to deliver to students across the pyramid. And then the funding streams buffer. They provide support to that comprehensive school mental health system. On the left side of the pyramid are the funding streams in blue that are managed by our education partners, and I'll walk through them really quickly one by one. And then on the right-hand side are, in orange, are the funding streams that are managed by your health partners. And then just really quickly, in our toolkit, if you download it or look at it online, there is this pyramid in it. It's taken right from the toolkit, and you can click on the different funding streams. So let's say you're looking at, you know, your partners, and you're like, well, how do I sustain our school-wide interventions? You can actually click on the corresponding funding streams to take you right to a very detailed description about each funding stream. So this is a brief snapshot of the 8 funding streams that we describe in more detail in the toolkit. For hour-plus long presentations or webinars, I walk through each with a lot more detail about the students that can be served, what types of services. But really quickly, I'm just going to walk through all 8 to just give you a sense of what they are if you're not familiar with them. And then the slide also gives you a quick snapshot of the funding streams that draw down federal Medicaid dollars, the funding streams that are quote-unquote flexible. You could debate me on the flexibility of those funding streams if you like. I'm around all day. And then the funding streams that really are targeted for specific types of students, not the whole students on a school campus. So again, in blue are the funding streams managed by education partners. The first one is called Educationally Related Mental Health Services, and these cover the mental health related services as part of a student's special education. So often these services are included in a student's individualized education plan or 504 plan. The second 2 are both optional reimbursement programs for local education agencies, school districts, county offices of education. These are programs that the school districts can enroll in where they can draw down federal Medicaid dollars to cover a portion of the services that they provide to students with Medi-Cal. The LEA, the Local Education Agency Billing Option Program, covers direct health services, and the SMA, the School-Based Medi-Cal Administrative Activities, covers more administrative activities like planning, outreach, enrollment in Medi-Cal, et cetera. And then the fourth and fifth, the next two are a little similar. Every Student Succeeds Act is federal funding for public schools, and the Local Control Funding Formula, LCFF, is state funding for public schools. And they're both a little bit similar in that they are both provide fairly flexible funding, although the dollars are expected to cover a range of services and supports provided in public school settings. So teacher salaries, some professional development, library books, so that it's a range of expenses. They're also similar in that they both provide a little bit more money for schools that have high percentages of low-income students, and they both have recently changed how federal and state funding goes to school, in that they emphasize a lot of whole child supports, which I know has been a lot of the topics today. So they really broadly include services and allowable funding for health and student supports. Moving to the healthcare side in brown, the first two are our state's Medi-Cal systems. Coverage for mental health services under Medi-Cal, which is our Medicaid program in California, is split between two systems. The first one is specialty mental health, which is provided by county mental health plans, which are often your county health or behavioral health departments. And then there is a non-specialty mental health that is provided through your Medi-Cal managed care plans. And these are your Anthem Blue Crosses, your partnership health plan. Sometimes you have Kaiser. It varies pretty substantially across the state by county. And Medi-Cal managed care plans are responsible for a range of health services, including non-specialty mental health services, but they also cover primary care, all of the prevention, the comprehensive healthcare services for young people enrolled in Medi-Cal. And then last but certainly not least, there is the Mental Health Services Act, or MHSA, or Prop 63, goes by lots of different names. And this is, again, pretty flexible funding provided through a tax on very rich Californians that we've had for a number of years in California. And this funding stream is managed by county mental health departments. So that's a quick snapshot. I'm not going into what types of services can be funded by each of these. I definitely encourage you to check out the toolkit, which provides really detailed information about each, as well as some examples about how those funding streams are used in school settings. I wanted to really focus mostly a little bit on some, I guess it's not really final since it's a brief talk, but some thoughts and strategies on how to leverage these funding streams together. And so I'll walk through each subsequently. So the first one is center students and interventions for students. I'm a little bit in a tough spot suggesting that you do this because our toolkit says this funding stream can be used for these adults providing these services. So I recognize that our funding stream doesn't abide by this recommendation. But I do think it's really important when we're talking about the funding streams, oftentimes we're talking about what adults can provide what services. And so I really think it's important for us to decenter ourselves, the adults, in these conversations and really look at what services the students want and what services the students need. I don't mean to suggest that you can ignore the limitations of lots of these funding streams. It comes with the territory. But I do think, I think it's, it's more of a value, I guess. I think it's really important that when we are thinking about these services is thinking about the students at the center. So some suggestions on how I've seen this work or how to do this is to utilize student advisory or leadership groups. How are you giving young people in schools leadership and opportunities to tell you what services they want? And then starting there and looking at what funding you can bring to sustain those services. There's lots of data out there on how students are doing in school, so looking at the data to inform what services and programs to bring in, and then thinking about the funding. And then the last is avoid leading with the funding. I think oftentimes, realistically, you're coming to this partnership with, I have this one-time funding, or I have these Medi-Cal contracts, and I can provide this on your school settings. And so whatever we can do to pause those conversations and think first about what the services are, and then thinking second or third or fourth about what the funding is. The second one is, I think it's really important to leverage Medi-Cal. I'm very happy and excited that there's lots of focus on leveraging Medi-Cal. And I really think we need to encourage leveraging other funding at the same time. And perhaps this is an unpopular perspective, but I don't think any comprehensive school mental health program or system can exist with only Medi-Cal funding. I think we really have to encourage these conversations to leverage other funding streams. Medi-Cal, at least currently, is very specific on what it can fund, who it can fund, to provide what services. And I think if we go back to the pyramid of comprehensive mental health services, you're not going to see Medi-Cal fund all of those services, those prevention, those school-wide supports, those engagement with teachers, teacher coaching, peer-to-peer to support, student-to-student supports. So we have to think beyond Medi-Cal often in these conversations, is how do we buffer, put as much as we can, leverage Medi-Cal, and then buffer around those services, those Medi-Cal funded services with other funding. I have some examples. So these are some examples of how I've seen it work in other counties. This is an example. The first one is an example of a community-based organization, CBO, a community-based organization that has a contract with the county to deliver school-based health services. And the county uses, I don't know if they blend, but they take a little bit of their Medi-Cal, especially mental health funding, and some Mental Health Services Act funding, and they put it together in a contract for this CBO to deliver school-based services. And this allows a CBO to serve not only Medi-Cal students, to provide clinical services to non-Medi-Cal students, and it allows the CBO to provide non-clinical services, so they can work with teachers, coach teachers, they can participate in coordination of services teams. So it allows the clinician to do some of those buffering services that support the direct clinical services. The other example I wanted to share is a second county that covers a portion of the cost of one school-based clinician. And so the county puts in some of their Medi-Cal, especially mental health dollars, into the cost of this one clinician on one school site. And then they ask the school to put up the remaining portion of the cost. And that portion that the school contributes, again, allows that clinician to serve not just Medi-Cal students, and also provide some of the non-clinical services. In this county, I've seen that the contribution of Medi-Cal dollars changes based on the percentage of low-income students at that school site. So if the percent of low-income students increases, the school portion required decreases. And then vice versa, as the percent of low-income students decreases, the school contribution increases. These are probably, I mean, if these are your counties, I don't know if these are your counties, that's probably oversimplified, but this is just an example of how we've seen some of these services, some of these funding blend together to really get at the comprehensive school-based mental health services. The third one is to build a bigger bucket together. I think often what happens in these conversations is one side of the partnership is like, so-and-so has all these unspent dollars, or that person has all these unspent dollars. How do we get access to them directly? And I constantly suggest gently against framing those interactions in that way, because I think what we're talking about is how do partner A and partner B bring the resources they have together in service of students, in service of services to students, as opposed to hypothetically a school saying, how do I get a direct contract for these county dollars, or a county saying, how do I direct the school to invest these sort of dollars to fund our clinicians. So I do think I encourage a partnership. So my suggestions around this are, when we're thinking, how do I directly get those dollars over there in that system? Just time out, pause that thinking just a little bit. I also encourage partners to think about, what resources and infrastructure can I bring to this partnership to build a better system? What do I have access to? What can I invest in to help build the system a little bit better? And then again, working together to make services better and more sustainable for students. I think this is probably a consistent theme throughout this conference, but this work is really based on relationships. And so how are you contributing to this bigger bucket, this bigger pie of services for students is definitely how I encourage these partnerships around funding to be navigated. And the last thought or strategy I would like to leave you with is when we're talking about, and oftentimes, in these examples, I'm talking about the county or healthcare partners and schools working together for school-based mental health. So I'm gonna stick with that. I guess it's not a fair dichotomy, but those two partnerships. But I think it's a little bit related to the previous one. It's important to recognize that you are one part of each other's much larger system when we're talking about school-based mental health. So on the illustration on that slide is meant to convey that, you might be coming together really focused on that comprehensive pyramid of school-based mental health services. And it's important for both sides of the partnership to recognize that that pyramid is actually only a piece of a much larger pyramid that both systems are thinking about. So for example, if you are a partner with a school and you are looking at their LCFF dollars and you're like, wow, this is really flexible funding. Why can't you divert so much of this to support the school-based mental health system? I think it's also important to recognize that those LCFF dollars are local control funding formula dollars, acronym soup, are meant to sustain and support the rest of that school system. So not just that school mental health pyramid where the two systems overlap. And vice versa, County Mental Health Services Act dollars are very flexible, and oftentimes there's lots of interest in using those dollars to support school mental health services. Those dollars are also meant to sustain the larger county healthcare system around mental health, not just the little pyramid. It could be a big pyramid, but not just the pyramid of school mental health, where I hope it's not a little pyramid, but not just the pyramid of school mental health where they overlap. So I definitely encourage the consideration, especially when you're talking about funding and partnerships, to recognize that you might be coming together to look at this pyramid of school mental health, and also recognizing that your partners have pressures to fund and sustain and create systems much outside of that school mental health system, and also hopefully that help support that school mental health system. They shouldn't be separate at all. I think I got you back some time. That is it for me.
No, I'm sure they're going to have questions for you.
Okay. You can't get your sandwiches yet. Again, so thank you. I saw head nodding, so I hope this helped illuminate some of the funding streams. I'm sorry I couldn't go into more detail about all of the funding streams. That's my email, and also ways to stay connected with our organization, as well as, again, another short link for the resource directly.